It's really interesting. Cardiovascular kidney metabolic syndrome is actually a new disease that the American Heart Association has put out there. And I personally find this extremely provocative and a really big advance in how we think about cardiovascular disease, because it's really a sort of the intersection of cardiovascular disease, kidney disease, and metabolic syndrome, which we had initially sort of been treating separately. But now that we've created this condition, CKM syndrome, which is staged like we stage cancer, to me, it's a really nice paradigm for thinking about cardiovascular disease very differently. And the idea here is that all these three conditions, cardiovascular disease, kidney disease, metabolic syndrome, are best friends or best enemies, in the sense that if one is unhappy, the others are going to be unhappy. So if you think about the risk factors that we traditionally think for heart disease, diabetes, high blood pressure, obesity, obstructive sleep apnea, kidney disease, of course, metabolic syndrome, insulin resistance, low HDL, all of these are captured within that CKM syndrome. So it's a really comprehensive way for now thinking about not just our patient's risk, but also how to really customize their treatment according to what stage of CKM syndrome they're in. So I've found it to be a really bold move by the American Heart Association. I also think it breaks down a lot of the silos that we practice in medicine, where we have the endocrinologist, we have the nephrologist, we have the cardiologist, we have the internist, and it really helps them to kind of cross collaborate and provide interdisciplinary care. Yeah, so it's staged like cancer, as I said. So it's stage 0 to stage 4. So stage 0 means you have no risk factors, you're in perfect optimal cardiovascular health. And stage 4 is that you already have cardiovascular disease with or without kidney disease. And so if you think about the staging system like we stage cancer, to me, it really helps us to identify people earlier in their course of disease. So would you be surprised if I told you that 90% of America is stage 1 or higher CKM syndrome? So to me, that's extremely, telling, because if I said that 90% of the country was stage 1 or higher cancer, certainly people would be paying attention and everybody would be jumping up and down and talking about it. And yet we're walking around with a big target sign on us for cardiovascular disease, which is the most likely thing that's going to happen to any of us, and we don't realize it. So the nice thing about these stages is that they're a bit fluid. So especially early in the course of the disease, you can go from stage 1 back down to stage 0. For example, if you have obesity and you end up losing a lot of weight, you'll go back to stage 0 CKM. So to me, it's a nice way to get both providers and patients to start to think about reducing their stage of CKM. And then again, we also start to think about targeting specific therapies according to the stage of CKM. And we help to identify more patients in stage 1 CKM than we have sometimes with many of our sort of traditional risk models that only incorporate cholesterol, they only incorporate blood pressure, they only incorporate kidney disease. This really is much more comprehensive. So, as a clinician now, I'm not just doing the pooled cohort risk estimator, the prevent equations. I'm actually doing CKM staging in my office every single day. And I use it as a way to really spur a conversation with the patient about lifestyle changes that can help them to reduce their stage of CKM. I go over the CKM stage with my patient as a way to really help them understand, because a lot of patients do understand staging with respect to cancer, but sometimes the idea of cardiovascular risk can be a bit more abstract. And I also use the CKM stage to start conversations with other specialists, whether it's endocrinologists, nephrologists, diabetologists, or internists, about, hey, I'm really worried about this patient because even though they haven't manifested with heart disease yet, they are stage 1 or stage 2 CKM syndrome. And I do think we need to be more aggressive with them. So, in a lot of ways, I think patients are a little oblivious. They don't quite understand the implications of heart disease until it manifests, because, heart disease is different from other types of conditions that cause symptoms. It can basically be manifesting inside of you silently, whether it's high blood pressure, whether it's diabetes, whether it's atherosclerosis, without patients realizing it. So when I sit down with my patients and use the CKM staging and go over it with them, sometimes it's a bit of a wake-up call for them to really understand implications of their disease and understand how far on the spectrum of developing heart disease they really are. So to me, it doesn't just help with kind of treatment, diagnosis, and management. It actually helps with prevention, because a lot of times patients will use this and start to implement changes in their lifestyle, changes in their behavior that can help to reduce their CKM stage. I also think it makes the concept of the disease real, because if I say, oh, you're at risk for heart disease, or oh, you have a calcium score that's positive, that can be an abstract concept to patients. But if I say to them, you have CKM stage 1, then they have a disease. Then they realize that it's not just these risk factors that we're talking about. We actually have classified them into having a disease. And sometimes that triggers a bit more behavioral change in our patients, where they're more likely to start to take action more seriously if they feel like they already have a diagnosis, as opposed to they have risk factors for a diagnosis. So it's a different way of thinking about the condition. And it really does, I think, help to anchor both providers and patients to be much more aggressive from a prevention standpoint, and be much more aggressive from a treatment standpoint, even in the patients that already have disease. It's interesting. I think CKM syndrome has started us down the journey of stepping out of our comfort zone as providers, because for the longest time we were siloed, looking at the heart, and the endocrinologist is looking at the diabetes, and the nephrologist is just looking at the kidney. So I think by doing something like this, creating this syndrome, it really has helped us to break down those walls between the specialties, and to really change our culture and our clinical inertia in medicine of just treating our organ, to take a step back and start to treat the entire patient. Because again, we know if the kidneys are unhappy, the heart is going to be unhappy. So I, as a cardiologist, cannot just treat the heart. I have to treat the kidneys. I have to treat the diabetes. I have to treat all of the risk factors, the obesity, the sleep apnea, everything that contributes to disease in my organ. So I think it's started a bit of a culture shift in medicine, where we're now going to start thinking about patients more holistically. We're probably headed towards more diseases that involve multiple organ systems. We're headed towards treating disease in a more upstream fashion. So what I mean by that is, we wait for the heart attack and then we put them on a statin. Now we're actually saying, let's go upstream to the first domino, which is that obesity, that metabolic syndrome, the microalbuminuria, the kidney disease, because those dominoes cause the other dominoes to fall. So rather than waiting for that last domino to fall and then doing something, we're actually going earlier.